Hello. Today I'm joined by Biz Steinberg, the CEO of CAPSLO. Biz, welcome.
Thank you so much, David, for inviting me.
Well, I'm so delighted to have the opportunity to speak to you. Obviously, you're the CEO now, and you've been the CEO for quite a few years at this point. But what we really want to know about is if you can kind of just tell us about your community action journey and how you got to this point, and tell us a little bit about the history of yourself.
Oh, okay. Well, it's interesting in that I grew up in a very small town in Wisconsin. My parents, my aunts and uncles, everyone was always working to help each other. So that was the model that all of my sister and all of our cousins grew up with, was helping. The church was a big part of it, our school. And as we matured, everyone just wanted us to go to college. But I never left that giving part and helping others. So fast forward to my last year at the University of Wisconsin in Madison, I was in human development, and my student teaching experience was in a Head Start center in Stoughton, Wisconsin, where the bilingual language was Norwegian, of which I am 100% Norwegian. I'm Steinberg because I married the love of my life, who was Steinberg, okay? And the Head Start program was under the Community Action Agency. So I didn't learn a lot about the CAP then, but I did about the Head Start program and the history, the War on Poverty programs. I got that then in 1972. Followed my future husband to California and took some courses here at our state university, Cal Poly, to get some credentials in California in early care and education. So I was had 5 years of experience with infants, toddlers, special needs children, and preschool, full day preschool, where the families were paying $85 a month for full day care, and I earned $3.33. In 1978, there was a job called the education coordinator for the CAP agency. I applied and I got the job. I had to make the transition from being in the classroom to overseeing 6 classrooms of young children for, at the time, the Economic Opportunity Commission. That summer, there was expansion money available. I had never written a grant, but we had so many children on the waiting list. We wrote the expansion grant and doubled our sites, doubled our sessions, I should say, to double sessions in 6 programs. So we had 12 classrooms then. After about a year and a half, we'd gone through 2 directors of Head Start. And so I did put my name in the ring. One of my mentors had said, you have to have 5 good years of experience at a minimum to go do that. So I applied, and I was interviewed by board members, by policy council, families, parents. And so in June of '84, I became the executive director. At that time, fast forward 5 more years or so, the organization in 1990, we had 75 employees. We had about $3.5–4 million. And we were in 1 county. The commitment of the board of directors and the staff to offer programs for those that needed us brought us to many other counties. And so today I can sit here and say, as of Monday, we have 988 employees at Community Action Partnership San Luis Obispo. We're in 11 counties. And we have the board just passed our agency-wide budget of $127 million. The need is still here. We're still advocating, and we're still trying to affect institutional change.
And you talk about your growth and the growth of CAPSLO. That's obviously a huge signal as to the community action model along with Head Start and how that operates. Talk about why that's been so important in your life and how you've grown the agency and how you've grown yourself.
Well, I grew it with an incredible team of staff, but the board providing, they're a tripartite board of directors. So we have policymakers, our elected officials, we have private sector, and then we have folks who represent the low-income community. The debates, the discussions right at our board table is the foundation. They direct me, I'm their one employee. And so we went forth to do programs needed within our home county, but then we branched out with the energy program and also migrant and seasonal Head Start. We were encouraged to bring our quality of program to other places. And so that has kept me going, I guess, knowing that more children, and it was said best by one of my past board members, Fred Nunez, who grew up as a migrant child. And when they were going to vote if we were going to go out of county to the Monterey area or down to San Diego, he said, if there would have been a community action agency when I was a kid, I would have had a quality early experience. Biz and the staff, I vote yes, and go forward and bring these programs to the families working in agriculture, the families that are providing our safe and sanitary food supply every day. And of course, after we've all experienced COVID, the families we serve were essential workers because of what they do to provide our food, our daily food. And that was, I'm honored that we serve their children so that they might work and they might improve their quality of life over time. Their priority is their children's education.
Well, we've spoke on it before, but as a Head Start child, I
Yes,
thank you
David.
for your years of service. And, it was really important to my family. And what was always, we found to be so valuable was the constant voice, of my mother when she was able to show up at the table and her voice was included. And I heard you said when you interviewed, you weren't just interviewed by one person, you're interviewed by parents, you're interviewed by the policy councils, by your boards, and all.
Right.
And community action cornerstone is around maximum feasible participation. Talk about, in your experiences, how that's been so important to community action.
The voices of those we serve, like if we're going to have say we're going to start our Liberty tattoo removal program, that isn't biz thinking that we're going to do that. It is the voices of those who were affected by probation, who grew up in middle school and thought they needed to have these antisocial tattoos. They're the ones saying to probation, how can I get this removed? So we partner with so many different government agencies, other nonprofits, foundations, and volunteers. So we have focus groups. We don't just think up, and we're in the middle of our community action plan right now, where all this focus group energy is going on. Our board members are out interviewing other entities, community foundation, other government, Department of Social Services, Public Health, the Housing Authority, all the connectors that we work with so that a family's quality of life, like yours, your mom's, and their voices of those we serve are the most valuable. Biz, no, we don't need to be open till 5, but we got to open at 4. We got to be there to till the soil, or get there before it's too hot to pick the strawberries. Energy, listening to the elderly and the disabled. I'd like to stay in my home, but I don't have a ramp. So our energy program has a variety of funding sources, including the Area Agency on Aging, where we can then build those ramps, but while they're there, maybe they're getting a PG&E refrigerator ordered too. So we try to meet as many needs, and then we're listening, always listening. The 2 crew guys visiting homes, they're sometimes the first ones to hear about a disabled child who might need Head Start. They might be someone who has had to report, be a mandated reporter on an adult abuse or something like that, unfortunately. but our eyes and ears are all around the community. And our priority are those that we serve. It's not, it's not me, it's not our leadership team. When I orient new staff, I talk about a bicycle wheel. And they're on the outside of the bicycle wheel where the rubber meets the road. They're the most important. And then there's all these spokes that come to this little center thing. And that's where I sit, that's where my department heads sit. The board is kind of the overseer in that circle, and we're the least of it. We have to coordinate, we have to have audits and do all the bureaucracy, org standards. We chose to go the way of pathways to excellence because we believe in continuous improvement. I'm getting off now, but org standards measures our compliance. We want to always offer the best practice, the best approach to whether it's a young child. We cover the lifespan. Those prenatal moms, and we have an adult day program for the elders who have dementia and Alzheimer's. So we cover the lifespan in collaboration with, in that case, the Alzheimer's Association, the families who need respite. That adult day program provides respite for a couple who are housing that grandma or grandpa, that veteran, so they can go to work. We're very focused on child care for all levels of income. So there are some programs, and our homeless program, we're getting ready to talk with them to see what they think is the most important for our BESOS grant, where we're going to help families have transitional housing. But I got to talk to the experts, and that's those that we've housed and what would make it better the next time. So we're very accessible, hands-on, and we do grow and change and evolve.
Let's talk about that. We're talking about growing and changing. What have you seen over the last few years as things have begun to...
The last how many?
The last few years. What is the major changes that you've seen in community action? Not just over time overall, but over the last few years. How have you seen your agency and the network as a whole change?
I think we have learned, and we really learned through COVID, how we have to keep working together. Working together with our own boards, with our own community, city councils, businesses, nonprofits. And we're just a microcosm at the local level. You take our 58 counties of California, put that together, we're going to have 58 state plans, right? Or county plans that get put in some magical state plan. And all 50 states send it back to DC. Our National Community Action Partnership Board has become much more connected to funding sources, to foundations. They've lifted up whole family approaches. They've lifted up, based on research, work that can be done out in our living laboratory that David Bradley always reinforces. He's our lobbyist for all of us, serving low-income people in the country. And that living laboratory is so important because that's where our elected officials, our mayors, our future employees, our state association members can come and see community action in action. When you've seen one community action agency, just like my colleagues here in California or in Region 9, you've seen one. That's the same across the nation. So we have our state association, CalCAPA. We're grateful that you're there, that you're here now, David. We've had a successful legislative day. Our assembly members, our state senators, I believe over these last many years, are much more engaged with us. We get the calls, can you help this family that's dealing with, a potential eviction or whatever it might be. The same at the federal level. I had an issue on the veterans payments for our adult day program. Congressman Salud Carbajal came to our rescue, met with the VA, took some time. But we need to also be connected and seek out and keep are elected officials at all levels aware of what the changing demographics are, the needs, housing. I would say housing across this nation, something's got to be done pretty soon. I can't keep just advocating. I got to see real housing coming around. So community action has become much more professional and much more data-driven. We got to prove what we're doing. We have to be very nimble with the research going on so that we can be implementing programs in a better way. I've also given up a program to another entity when it's appropriate. So we have to be problem solvers with our colleagues and our partners so we make the best decision. And that was a children's assessment center, which we got built. But it was Medi-Cal billing for California. And our early Head Start children were benefiting from the center, but it was better passed to the county who had the infrastructure on Medi-Cal billing, for example. So we turned Martha's Place over. Now, on the other hand, the county during COVID, we have needed a detoxification, a medically assisted treatment program in our community for 30 years in San Luis Obispo County. And so there were some state dollars available, drug and alcohol, who we work with, and the Board of Supervisors, Biz, can you get this built? Or CAPSLO, I shouldn't say Biz, CAPSLO, can you get this built? And they gave us some of the funds. We had to raise money. We had a good site right on our campus with 40 Prado, which is our homeless services center. Mm-hmm. And we got that built during COVID. Wow. The supply chain problems had just happened. We came to the board at right before our holidays and said we're $347,000 short. And the board said, but we've got to do it. And so my development director was able to coordinate a large $250,000 foundation grant from the Bank of America Foundation in our local region. So there's always a way to make it work. It just takes relationships, it takes trust. In your organization, you have to have integrity, and you also learn every day. And we're not perfect. So we make progress, we change, we evolve, and COVID's taught us a lot. We have a lot of people who need our services, and we are still, I think, one of the best advocate organizations, community action as a whole, because we're in the communities bringing care and service for any elected official to point to ask us to help someone. And I think was a brilliant design, community action. And the fact that the board structure has stayed is the key to it.
No, that's absolutely true. It's always keeping that tripartite structure has allowed us to have that flexibility. So it's wonderful to hear that you feel that we've evolved fairly rapidly over the last 10 years. And you mentioned early on about performance excellence, becoming agencies of excellence. But overall, where do you see, what is your vision if you're painting it out for the future of community action? Because I should mention, not only are you the CEO of your agency, you also serve on the state board, the state association board, and you serve on the national board as well. So you have a really big picture of what community action looks like all across this land. And so as you look to the future, where do you see community action continuing to evolve?
I believe we are going to be continuing to grow as an advocate for equity, diversity, inclusion, and justice. And that's different in every community. I've learned from the National Board and our National Commission on Equity, Diversity, and Inclusion that we have more work to do. And we have more work to do systemically with even the silos at the federal government level, and even visiting here today with our different elected officials in California. They, I know, want to learn and listen to us on how something could be streamlined or could be collaborated, and make sure we are not duplicating services. Yeah. I'm always striving for that. And I think sitting on the national board as I have, I've grown to appreciate the diversity we have across this nation, and we just need to keep supporting people as they continue every day to helping people and changing lives. It's so important.
Absolutely.
I just would like to encourage young people out there and young professionals to come check us out. Community action. I have been in it 45 years now.
Wow.
My children have grown. They're married. I have grandchildren. And I'm a better human for having done this work that started back with my family of origin, I believe. And we invite you young folks to please come take a look. We need you. We need you to carry on this tradition. We need you to carry on the advocacy and be the voice with the voices of those we serve. Critical.
Wonderful. Well, thank you. Well, thanks to Biz Steinberg, the CEO of CAPSLO. Thanks a lot, Biz, for joining me.
Thank you, David.
Absolutely.
So much.